This is a customer journey that most of us would want if we were to ever become a patient. This is a patient journey that Napier Healthcare Solutions and some of the world's leading healthcare providers are bringing to you. Henry Santos is a 50-year-old pensioner who has a history of poorly controlled hypertension and hyperlipidemia. One day, while climbing up the stairs, he suddenly feels a general tightness around his chest, followed by heavy pressure down the center and pain. He has had similar episodes of pain in the past, although milder, following physical activities like climbing up the stairs or mowing the lawn. He worries he may be having a heart attack and immediately calls for a cab to take him to the hospital. While in the cab, he calls his regular doctor at ARC Hospital, Dr. Chan, to tell him of his chest pain and needs help. After a few questions, Dr. Chan tells him to stay as relaxed as possible and that the hospital will be ready for him when he arrives. The cab arrives at the hospital. Before he gets out of the cab, Henry checks his mobile phone to find a message from the hospital telling him which emergency room he has been assigned and that his doctor will be waiting for him. As Henry has chest pain and has called in ahead, he will be taken directly to the ER by a nurse the moment he arrives. Henry enters the hospital, clutching his chest again, and is helped to a seat by a nurse who immediately registers him and checks his blood pressure and temperature. All the information is captured and automatically routed onto an iCloud, where it is accessible by authorized staff of the hospital, wherever they are, at their desktops on hospital premises, or at a point of care outside using their mobile devices. The nurse then takes Henry to see Dr. Chan. In consultation, Henry tells Dr. Chan what he has been doing before he felt the sudden pain, and how he is feeling. Dr. Chan listens closely and also refers to his iPad for Henry's latest reading and past medical records, and to recall some of his own notes from previous visits. Dr. Chan then tells Henry that he wants an electrocardiogram, an ECG, and a stress test to get a close reading of Henry's heart condition. He orders the ECG on his iPad. He also orders his lipid profile, blood glucose, and HbA1c tests. Henry gets his ECG done in another room. As soon as that is done, Dr. Chan can see the results on his desktop and firms up his diagnosis. Henry returns to Dr. Chan's office. Dr. Chan tells him that based on the history, results of his ECG and stress ECG, he can tell that his pain is most probably a manifestation of stable angina. Dr. Chan then proceeds to tell Henry that, given his hypertension and hyperlipidemia, he is at risk of developing further problems in the heart if he does not follow medical advice. Dr. Chan advises Henry on the lifestyle and diet changes he needs to make. Dr. Chan tells him he will be giving him medication to relieve further episodes of pain, and that he needs to take his blood pressure medication and cholesterol medication regularly. In addition to that, Dr. Chan is putting Henry on a personal health monitoring program, and that he will be given instructions later on how to do that at home. As Henry leaves the room, Dr. Chan prescribes medicine and signs Henry up on a personal health monitoring program with the hospital. Done with his consultation, Henry steps up to the payment counter. The cashier calls up Henry's details on screen, refers to his bill, checks on his eligibility for Phil health benefits, completes the calculations. He then generates the bill, and Henry pays with his credit card. Upon payment of the final bill, Henry makes his way to the pharmacy to collect his medication. The pharmacist on duty already has his medication ready and packaged, so as soon as he confirms Henry's identity, he hands him his medication and gives him instructions on how to take it. When they're done, the pharmacist tells him to make his way to a room down the hall to collect the kit he needs to get onto the personal health monitoring program that Dr. Chan ordered. In the room, a nurse shows Henry the devices he needs to take readings of his blood pressure and pulse rate, and a tablet computer running a specialized program that pulls together all the results and stores it on the cloud for access by the hospital's caregivers. She shows him how to open up the app on the tablet, how to take readings with the devices, and how to refer to the results in the app. At home, sometime later, Henry, and more importantly his wife, are happier because he is healthier. He has made positive changes in his lifestyle and diet, and has been taking his medication faithfully. All this time, he has been tracking his blood pressure and pulse rates, taking regular readings at home, and having them automatically routed onto the health monitoring system through the app on his tablet. His blood pressure has gone down significantly. He refers to his last 3 readings and also to check on his next appointment date. The nurse calls to check up on him, and he picks up her call, all within the app on their tablets. Henry is doing well. He has had no more episodes of chest pain since he last visited the doctor. The nurse and Henry confirm their next appointment and end the call. Constant attention paid to one's needs, quick access to a care provider, fast diagnosis and treatment, healthcare extended to where we are most comfortable, at home and just about anywhere else, all at a lower cost of money and time. This is the future of healthcare everywhere, and it is here with us today, powered by Napier Care.